Let's go to visual diagnosis inspection. The topic is thin tongue body. A thin tongue refers to the thickness and not the breadth of the tongue. A tongue becomes thin when there is too little fluid and too little blood to fill the tongue. That is, there is too little yin in the tongue. This will be due to there being too little yin and or blood in general, or there being something that has damaged these yin aspects, which will be some form of heat. The color of the tongue will be the determining factor. A red tongue indicates that there is heat damaging the yin aspects, and a pale tongue that there is too little blood. A thin tongue is not seen as often as might be expected. Many clients are deficient and yin deficient, but because they also have dampness and phlegm, this results in their tongueness being swollen. This means that a tongue that would otherwise have been thin due to blood deficiency or yin deficiency can be swollen due to the presence of dampness and phlegm. Thin refers to the thickness, not the width of the tongue. The body of the tongue is formed by fluids and blood. Therefore, a thin tongue always indicates a deficiency either of blood or of yin fluids. In the former case, it will also be pale, whereas in the latter case, it will be red. A thin tongue is actually not common, probably because dampness and phlegm, which make the tongue swollen, are such common and predominant pathogenic factors. Because they tend to make the tongue swollen, even if the patient has a concurrent severe blood or yin deficiency, this would not manifest in the tongue body shape. In my practice, for example, of 2,378 patients, fewer than 2% have a thin tongue, whereas nearly 37% have a swollen tongue. The tongue body is thinner vertically and smaller horizontally and vertically than normal. So let's look at the indications of a thin and small tongue. For thin tongue, there's Qi and blood deficiency, and the tongue body will be pale and the thin body with thin coating. The pathogenesis, when Qi and blood are deficient, the tongue body lacks nourishment and becomes thin. When the tongue is small, the indication is yin deficiency with heat, and the tongue body will be red and thin, small body with little or no coating. The pathogenesis, and when there is a deficiency of yin, the tongue body is underfilled, and thus the tongue size will shrink. For a remark, a thin or small tongue without other complaints may prove to be congenital and not indicate a pathology. Atrophy of the tongue is due to loss of nourishment because of deficiency of both heart and spleen Qi. As a result, Qi, blood, and yin fluids are deficient and fire blazes in yin deficiency. A pale and atrophied tongue suggests deficiency of both Qi and blood. An atrophied and red or crimson tongue suggests intense heat, injuring yin, or blazing fire due to yin deficiency. According to recent advances in tongue research, other conditions can also lead to atrophy of the tongue, such as deficiency of certain vitamins, blood deficiency, digestive dysfunction of the stomach and the intestines, malnutrition due to severe infections, and muscular dystrophy involving the tongue. A lack of blood and body fluids causes a decline in the volume of the tongue body, which is manifested in a thinning, shrinking, or contracting of the tongue body. Depending on the individual's constitution or life circumstance, spleen Qi deficiency may lead either to accumulation of dampness or a lack of blood. Both are secondary aspects of a disharmony of spleen Qi. Any long-term deficiency will lead to impairment in the transformation of food into blood. Because of this, every pale tongue reflects an element of blood deficiency. However, when blood deficiency is an important contributory factor to an illness, it is expressed in a pale and thin tongue body. At the onset of such a pathology, it will be pale and dry. This is especially true in women who suffer from profuse menstrual bleeding, breastfeed for long periods of time, or follow improper dietary habits. A thin, pale tongue is an important feature in individuals who suffer from a lack of blood. If this condition is not treated, kidney yin deficiency may develop as blood nourishes the yin. The development of this particular pathology is visible when the pale tongue body changes its shape or takes on an intense red or orange tinge. If the pale tongue is dry, the pathology is not so severe. That is, the blood has lost its moistening function, but the deficiency is not yet significant. Typical symptoms of blood deficiency are dry or itchy skin, hair loss, a pale tinge to the skin, numbness in the extremities, and dizziness. Thank you so much for your attention.